start streaming and turn it over to you, President.
Hello, welcome everybody. Thank you so much. All right, we're going to start with the agenda. Let's see, update on previous action items. I was able to go in and close the grant projects 4, 5, and 13, and then also the active projects 56 and 10. So those are all closed and should be cleaned up.
Great.
So excellent. That's good. Yes. The board approvals, I'm working with Kevin on that to get all of the documents together and then get that scheduled. So that is something, a continuing action item for myself to do that board approvals.
Mm-hmm.
Okay, next thing. Salam, were you able, or can you still send us the notarized passport pages in Signal? Don't think we got those yet.
Yes, I will do that when I get hold of my laptop this evening.
Okay.
I have the copies on my PC, so
perfect.
I'll send them.
Great. Along that note, I'd like to we were talking yesterday, and we have been talking for the last week on our next trip to Ghana and when that will take place, and we don't have any idea yet. Although we're thinking maybe, I mean, we're not sure when we're thinking, but we're thinking it needs to be a bit cooler than last time, and we need to start planning, because if we're going to solicit potential travelers with us, then it will take some time. So my question to you, Salam, is: do you think that, how is our residency cards? Is that that's separate from the bank account? And so, do you have those ready to mail to us, or will we have to go back through the visa process, or how will that work?
Not yet. I've been expecting an email from them.
Okay.
Because after I sent the notarized passports, they asked me to expect an email.
Okay.
But I haven't received the email. So on Monday, I'll speak with the bank manager to check on the man, because he have some relationship with him.
Okay.
So that we get to know what is holding it up.
Okay, great. Yeah, so if you could take that action item to follow up on our residency cards, that would be great. Just so that we can better plan. We're thinking, we were kind of thinking March.
I literally said to Kevin, because I've heard this come from Ben before, that Ben was cold. And so I said to Kevin, I said, I want to go to Ghana when Ben is cold. I want to see what the cold is like. So that's what we're
but with the travel plans, our visas have actually expired. I mean, we couldn't travel to Ghana now with our current visas. They both expired, I believe.
No. The ones in the passport?
Yeah.
No, they're good. And let's see, I want to say,
because of the 6-month rule.
Well, I mean, yes, that's one thing, but they haven't expired. We still could go on them because they don't expire for another couple of years, I think.
Oh, really? Okay.
We got the longer one, but what had happened last time, Salam, which you may not know, when we went to leave Ghana, the gentleman was looking at our dates and stuff and asking whatever, and we had almost overstayed our 30-day visit there. We had one more day. If we had decided to leave the following day, we would have been in trouble.
In violation of our visa, yeah, which could cause major problems. So, in any case, if you could just take the action item to follow up on those residency cards, that'd be great. Okay, great.
Okay, and then Ben, have you been able to get the documents from the medical event 79 yet? Now that you're back in Tamale?
Yes, I got them. So I'll scan them and I'll send them over.
Okay,
yeah,
great.
Yes, I met him this morning to receive them. So I'll scan them and then send them over.
Okay.
Great,
yes, and if I remember right, I'm scanning 100 at a go, not above 100. Okay, that's fine.
Yeah, 100 per file is about,
Okay.
I think, all that Gemini could handle reliably. So
Okay.
I can't remember that exact prompt that I used, but I will work on getting that data, because we actually have, as part of the new Shield app and the way that we're going to be collecting data, we actually have a data migration part to get the existing data in Smiley into the new format. And so I'll have to figure it out, but send it on over when you get a chance.
All right, sure.
Great, thanks.
And it's nice too, because the app literally keeps track of how many you've scanned. And so it'll show that, you have 79 scanned, and then you scan another page. So it keeps track at the bottom, which is really nice. I went ahead, just because I'm like this, I went ahead and counted out 100 per thing, but then I still watched the scan and stuff too until I got 100, and then I saved it off. So yeah.
All right, sure.
Great.
Thank you.
Great.
Okay, let's see. Warihana, update on the collaborators, and partner change on the website.
Yes, I've made a change. So I've now taken out the collaborators on the home page, and I've moved them to the collaborators page, which was then partners page. So now when you go to a page called collaborators, you would find the foundation and then the 3 other organizations.
Perfect.
Okay, excellent.
Perfect. Thank you for doing that.
Yeah, great. That's great. Okay, and then Warihana went ahead and listed the trusted brands of antibacterial soap in the Discord channel, so that's good. We can go from there.
Yeah.
And Salam's working on pricing out the 800 bars. What's an update on getting the antibacterial soap for the project for, Salam? You might be muted, Salam.
Yes, hello.
Hello.
Yeah, sorry, I was muted.
That's okay.
So I think the antibacterial soap, among the ones Warhana shared, if we are going for the cheapest, is the Dr. X.
Okay.
Though it's smaller, but it's 10 cedis, which is less than $1.
So maybe
Yeah.
if is it too small, Salam? Maybe we shouldn't go with it.
Yeah, it's small. It's small.
Dr. X is the same size as Dettol and Camel, and these two are even pricier than Dr. X. Salam. Camel and Dettol, their soap is very small. Maybe it's Power Plus that will be a bit bigger. Yeah.
Sorry, Salam, I think you're muted again. Salam.
Yeah, hello.
Yeah, hello.
Yeah, with the sizes, I don't know, but I think Dettol used to have. It's actually been a long time I tried buying any of them, but the Power Plus, I think the Power Plus and the Dr. X is the same size. That I know for a fact, but they're also the same price.
So I
But
think on this, if based on the price of a 10 CD, I think Warihana, would you mind just making a recommendation for us now as to which one that we should buy based on size and your knowledge?
So it's like all the antibacterial soaps are usually small. So Camel, Dettol, they are also very small. Power Plus, I can't really remember the size.
Okay.
So I'm sure Camel and Dettol is the same size as Dr. X. and Camel and Dettol are very expensive. So considering that they are all almost the same size, if we are going with the price, I think Dr. X would be the best option. I was also thinking of the same thing. I would have recommended the same thing, even if Salam hadn't mentioned it.
Okay, great. So Salam, will go with 800 bars of the Dr. X. Will that be okay with you? Okay, good. And then you don't feel there'll be a problem procuring those and establishing a new supplier for that?
No, I don't think we can easily buy from even the supermarkets.
Okay, great. And then I guess maybe if you can establish a supplier, maybe not this event number 4, but event number 5, by event number 5, hopefully we can get a supplier for that set up and get some kind of a discount, even if it's 10 bars for free after buying 800 or whatever the number is, because we will be buying a lot of soap going forward. And so I don't know if you'll be able to identify a supplier now at this point in the effort of event 4, but if you could set that up going forward, that would be ideal. Great. So Salam's going to take the action item to put, I guess, Ben, what do you need from Salam? So I'm sorry, I don't want to jump ahead, but I need to comment on something. So Salam, Ben, let's talk a minute about what Salam needs to do to put the 800 bars of soap on. He needs to put that on a purchase invoice to you, correct?
Yes, correct.
And then also on that same purchase invoice, Salam or Ben, I don't know who's working this now. I think it's Ben, or maybe it's Warihana because she's in Accra. I don't know, but we need that charger. We need a charger for the battery.
Yes.
And
I think
so,
with
go ahead.
okay. Yeah, no, you finish, so I'll just come say something about the charger.
Yeah, no, I was just going to say, wherever the charger is, that needs to also be on the same purchase invoice. Agree?
Yes.
Okay. So then what did you find on the charger?
So I was speaking extensively with the guy about it. I had to take a picture of the battery to send it because I wanted to be sure that whatever we are getting would fit the purpose for which we are getting it. So he said yes, he's into electronics and the charger is actually good for charging lithium batteries. So I spoke with Warihana today, and we agreed that she would pick it up from the guy.
Okay.
Yes.
Beautiful. Beautiful. Great teamwork on that. And so I guess Salam's purchase invoice will not include the charger, but Warihana will create a purchase invoice for the charger. Is that what you want to do, Ben? Since the money has to go to Warihana now?
Yes, I think that would be fine.
Okay.
Yes. So we'd have to just finalize when the guy delivers, then she can create a purchase invoice.
Okay.
Yes.
Great. And so just to be clear, so Salam, the 800 bars of soap will go under Project 4, and Warihana, the charger, will go under the office. Is that how you want to do it, Ben?
Yes, I think that would be best.
Okay.
Since we'll be using the charger not just for this event only.
Yeah. And so Warihana, you're good with that. Salam, are you good with that? Okay, great. Perfect. So those are the two things that I wanted to just discuss, as they were somewhat related to purchase invoices and that. So Presidu, what's next?
And you went ahead and did the PSAs for
the event.
For the event.
Yeah, so I went ahead and created, Ben, I'm going to get you in 1 second. I created the PSAs, which were 5 of them for the event. They all were uploaded to YouTube just because they store stuff for us for free. It doesn't affect any of our disc or anything. And why not? We can include them maybe in some social media posts, etc. They are all in English, and I saw that Abbie had taken it to the next level, which she worked with Zora to do the translations into some. So we have the scripts that I wrote, the audio that I wrote, that I used. I used a tool to generate the audio, and I used Canva to put them in an actual video so they could be uploaded to YouTube in that regards. And I think, Ben, at this point, you should have everything you need on that regarding the PSAs and making the big long playlist for the event. But go ahead, Ben. You had your hand up anyhow. What is the status on those things?
Yeah, so I received the translations from Zoera. I have someone who is currently working on the translation in Dagbani too.
Okay, great.
So yes, but that means under Canva we have the video file I can easily fit them into by replacing the audio.
Yeah.
Okay. So
Yeah,
I'll look for that under our brand.
Yeah, honestly, I'm so sorry, but I have to apologize, but I'm not good with Canva. And so I'm not sure where those projects landed. Like I didn't probably put them in the right place, Ben. So if you, I did them in Canva, but I don't know where they are. I can look really quick. I think I did them under the user give basic needs at Gmail.
Oh, okay. Yeah, but sometimes if it is a private one, it wouldn't show
For you.
for me. Yes. So
Right,
that
and
way you can
that's
just share it with me.
okay. So it's what, and let's do that right now because I have Canva open. I'm logged in. I mean, you could easily log into I don't know if you
Yeah.
typically do. This is what I never know. It's like for me to get the brand stuff, I need to go into Canva as give my user that I'm connected to is give basic needs at gmail.com. And that's where the 5 projects are.
Okay. I think I got invited using my personal email. So under
Right.
Canva, there's just a section I can switch to the organization to be able to use all assets there.
Okay. So
Yes.
I guess my question is, can you get to what I did, or do I
No,
need to do something?
I think I'm currently here and under our brand templates. I don't see it there.
No, see, because I think they're just under projects. See, I don't get the brand template and all of that either. So they're just projects under give basic needs at gmail.com.
Okay. Yeah, then I think that might be for you alone and not a brand template. But under the options, when you click on one of those files, under the share options, there's an option to make it a template or just to share the link with me. If I have the link, I can put it under the template.
How about this, Ben? Can you try to log into Canva as the give basic needs at gmail.com?
Or maybe we should do this right after.
Okay. Yeah. Though I've not done that yet before. So I'm always logged in as Benjamin.
So that's excellent. Thank you for that help. I appreciate it. And Kevin, yes, the beautiful, beautiful, wonderful app that you've designed. So go ahead and talk to us about that.
Thank you. Thank you.
The RN Scribe system.
Yeah, thank you. Thank you. I will go ahead and share my screen because I want to go over it real quick with the group. Thank you for the love. Appreciate that. I did work hard on it. I'm going to do the entire screen really quick. And so, can you see my screen okay? Okay, great.
Yes.
Great. So we're going to do the Shield app as I named it, just because it was shorter. And so it's for the Northern Health Shield. So just called it the Shield app. This is essentially the login page where the RN will put the prefix on. That means that every record that's submitted by the RN will have that prefix of their initials. And then this is essentially the application password, which is the detailed project number. That is what allows them to essentially unlock the app. Please interrupt me if you have any questions along the way, because after this presentation, I want to just make sure that we're good to go, because I'm going to lock the interface down and then actually build out the back end. So I'm waiting to do that based on the evaluation of this. So if you have questions, now's the time. Just interrupt me and let me know, especially because I can't maybe see you. Just comment and I'll stop and we'll go over it. So
and I can watch the meeting too and let you know.
Yeah. Oh, perfect. So so this is the secret portion of the password that allows the individual RN who's denoted here by their initials to go in. So once they unlock the app, you'll see the authentication status, and there's a status up here for network connection. The first thing that they can do is, I made this like the awesome bar, in that it's not formal as to what information they search on, just that they put in information. So you can see ID digits. I didn't want the RN scribe having to flip between characters and digits. And so it's primarily all digits with the exception of a last name search. And so you can see down here, these are the examples for what is called fuzzy logic. That's maybe I'm dating myself, but that's what we talk about in the software engineering world. At least we did 20 years ago. and so this fuzzy logic essentially says, I don't know what you're giving me. I don't know if it's an internal ID. I don't know if it's a Ghana ID. I don't know if it's a date of birth, but I'm going to figure it out for you. You just put the numbers in. So that's how the awesome bar works, is kind of this idea of fuzzy logic. So the first one here is, I decided not to strictly use the Ghana ID as the primary key, if you will, in the system, or the unique identifier, because I felt it's always good in software engineering and systems design to have an internal ID that essentially no one else has. And so I'm creating a sequential number for every record essentially that we create. When I do that, it'll be called the GBN ID. And so no one else will know that other than maybe me or someone who's looking at a specific record, trying to troubleshoot something based on the back end, et cetera, et cetera. And so that's what this first number is. This is our pretend Ghana ID. And then this is their phone. This is a phone number example. So without a country code, so you can search by a phone number, the Ghana ID number. You can search by a birthday with the slash. So it's just month and year. And then you can also search by last name. And so if we just take, for example, what the would-be Ghana ID number, we don't have to type the GID, any characters. We just essentially at this point do a search. We find that these two records come up under there. We can see one's a dependent, one's the primary. What I want to do before I get into this really quick is show you what's going to happen on day one with everyone. And that's essentially the system will have no data in it. So what the RN scribe will do is register a new patient number every time. So they're essentially going to click on this button. There will be no searches because there'll be no data in the system unless the individual has gone from one table. I think it's still the plan, and correct me if I'm wrong, is to have one table essentially do everything. And when the person's done, they leave the table and don't return to any table. They go home for the day. Can everybody confirm that that's how the flow will happen? Salam or Hana or Ben, is that how you see it happening? Or are they going to move from one table to another table, etc., for different services?
Yeah, where I think they might have to move to another table would be the vaccination. Yes. I don't think we would have someone to do the vaccination on every table. That is what I'm thinking. I don't know if that's outside of the plan, because from the last event, it's like we had some people who were just trained for the vaccination at a particular table. So when they move from other tables, they all land there just for the vaccinations. But yes, but if we are getting, if we want to change that now and we want to have it all done at the table, then that means when we are picking the volunteer, we need to make sure that we have people to do the vaccinations on each of the tables.
Yeah, we could.
And I think Salam did thumb up what you were saying, Ben. So they are going to be moving possibly for the lab and the immunization or whatever. Maybe that's a separate table that Salam's going to set up. But yeah, he did agree with that. Okay.
Yeah.
Yes.
Okay, so let me see if I've got it right then. So
thank you, Salam.
Yeah, the individuals come to the event, they queue in the chairs in front of the table. The table performs all necessary vital gathering, and then they're turned over if they're negative, they're turned over to a vaccination table that sits essentially behind the current row of tables to receive their vaccination, where they queue again, and then they're done for the day. Is that what I hear?
I think they're getting tested. Are they getting tested and vaccinated at the same table?
Yes, I think so. With what CCO described is what I think. After they get tested, we from the last, I'm speaking with experience from the last event, then we can then see how we are moving forward with that. After they get tested, it's indicated on the paper that the person is negative. So they take it to the vaccination table, and that is where they know that this person needs to take a vaccine.
Okay.
Then it's done. Yes.
Okay. And that's the way you see it as well. So the only thing that the last table does is the vaccination based on their negative results. Is that agreed?
Yes.
Yeah, good. Thank you, Salam. Okay. So with that, the only one, I'm going to go back to my screen then. The only one who will be searching for IDs will be the vaccination table. So everyone else I'm just going to call them the first row of tables. The first row of tables will simply be registering patients, because there's no chance that they're in the system already, because the system is brand new. So the first row of tables, if you will all be doing this. Basically putting in their full name, their date of birth, their gender, their phone number, if they have one, the Ghana ID, hopefully they have one, the height that is on the Ghana ID card, known allergies, chronic conditions, and then they'll be taking the vitals: weight, temperature, blood pressure, respiratory, pulse, SpO2, and their pain level. And then they'll perform the test. We're still at table 1. Then they'll perform the test right here that says Hep B, Hep C, and HIV. Then if they're negative, they'll set it to negative. Check any supplies or things that they've given them, whether that's condoms, deworming, multivitamins, pads, etc. And then they will check if there needs to be a follow-up referral, type in any public notes, any private notes, and hit submit. This is all done in table 1, if I understand correctly. Is that the way that you see it that way as well, Ben and Salam? Great. And so then at the second table, they'll give their ID, which will hopefully be their Ghana ID card, to the second table person. The second table scribe will take the number, key the number in, do the search, find that it is John Doe, click on it, and see exactly the alerts up at the top for allergens and chronic conditions and any positive tests that they might have. In this case, they would immediately say, I'm sorry, I can't vaccinate you now. You need to go for a follow-up visit or talk to someone. You know, they would defer them to I'm assuming that the first row of tables will have an area that they refer people to who are positive for consultation. So off to the side. And so is what they would see in this case is that they're positive for Hep B. They can't get a vaccination. So essentially there's nothing more that we can do. They would then defer John Doe to the consultation group. John Doe should have never landed at the table at the second table, but have they would be caught here with this big safety alert saying, hey, you are positive, we can't give you a vaccination. Does that all make sense?
Yes, yes.
Great. So then what the second table scribe, let's call her RN, is going to see is that in fact John Doe, let's pretend that John Doe is not positive for Hep B. She's going to see any past visits which there'll be none, and there'll be no vaccination records on file here because the system is brand new. This is our first event. She'll scroll down, see the demographics, not change anything, see if there are any new vitals. This is confusing because the vitals will have already been taken.
So then they would.
It was my understanding that at the first table they would get the vaccination as well. So that then you would collect all the vitals, the negative test, and then down here, and what you gave them, and then you would add the vaccination for hepatitis B, 1 dose in the right arm, and say at the bottom, submit.
Yeah, Kevin.
Yeah.
So this is about enabling and edit functionality. So let's say on table A, they create the patient, and then the next table, they search for the patients, and they should be able to edit. So even if we are able to have all on one table, including the vaccines, I think the edit functionality is still going to be needed, just in case there's a need to change anything. Maybe a scribe mistakenly type a particular temperature when it's supposed to be a different temperature. There should be an opportunity for them to make an edit.
But here's the problem with that is that when the first I'm sorry, really quick. Let me just explain this really quick. So table 1 creates John Doe and sends John Doe to table 2. The scribe puts in the ID just like we did here, finds John Doe and sees the alert here, and John Doe is not positive for Hep B. This is not here. Forget that. They're literally going to see this record. And this record was inserted just minutes before by table 1. if they enter data here for any reason or record the vaccination, it will show up here as record 2, which is not what we want. What I hear Warihana saying, which I don't know if this is right, I don't know if this is right or not, but is that Warihana thinks that there should be an edit button here that essentially that allows them to edit this record maybe only on the day that matches today.
Maybe you could say like additional info rather than edit.
Add info.
Yes, Kevin, it's an edit. So but an edit.
Yeah, but what I'm saying is you can't just have a blanket edit because you don't want them editing a record from the past. The only record they can edit or would be able to edit is that record from today.
Yeah, that's all we need to be able to do.
Right, and that wasn't designed for, because I didn't plan on them moving from one table to the next. So this is why we're talking about this and why this is critical. I hear what you're saying, and I think that there should be I also think that there needs to be some way to edit the today's record, or better yet, I don't know if this would work, but let's just talk it through. If John Doe lands at table 2 and gives their Ghana ID, the scribe at table 2 hits search, sees their record. It would be better if this date matches today. Well, we're going to have.
So when they even.
Okay, Kevin.
Yeah.
So, let's say this is the first event we are having.
Yeah,
so when,
it is.
Yeah, so let's say they do have to move from one table to another for vaccination, or maybe for some reason they need to edit the record. Yeah. What we can do is, when they search for the user, let's say using the Ghana card ID, then all their records would show up.
Right,
now,
and they do.
So each of the records have a date.
Yeah.
And then each of the records should have an edit button in line with them.
Yeah.
So that.
Yeah, but we cannot have if you're looking at a record from 11/5/25, you should not be able to edit that. It can only be editable from today's date. We wouldn't want a scribe to edit a record from the past.
Yeah, so we can restrict it to just editing the current day's record.
The current day's record, yeah.
Yeah.
Okay.
Because honestly, at this event, there's only going to be one previous record, and that's from the previous table.
Right. There'll only ever be right. Right. And I think that this edit button for today makes sense, because if we decided to put a third row of tables with another nurse RN scribe who did a different type of vaccine, let's just say the meningitis, we wanted to separate the hepatitis vaccines from the meningitis vaccines, then the third table would also be able to add a vaccine to the current day's record, but they would not be able to change the record after the date. So tomorrow, if you have another event and that person shows up, the RN scribe can't go into that record from yesterday and change the person's temperature or add a vaccine. It would have to be a brand new record that was entered on today, stating that they got the meningitis vaccine or whatever it was that happened.
Right.
Okay, so that's a new requirement. So I'm going to take the action item to allow the RN scribe to edit the current day's record, period. So it's what will happen is when they click edit here on the button for the day, it will populate all the information down here, and then they will be able to add the vaccine. When they add the vaccine, they'll choose it, say what dose it was, where it went, and then they'll be able to save the new version, revised record, essentially. Does that make sense to everybody? Great. And Ben, do you have anything? Ben, you're good as well. Does that make sense to you?
Yes. I think the edits for just that day would help.
Okay. Yeah, because we wouldn't want them to create a new record at the second point, at the second table. They don't deserve that. There should not be another record for, the second table here on the same date. That will just pollute things. Right. So that's good. So I take that action item to make that change. That's good. That's why we're talking through this, is because those are design decisions that will affect definitely a lot. So that's good. So then what you'll see here too is up here, you see the vaccination records on file. You'll also see I don't know if it's only this. Sorry, I don't believe I built in, and I need to take the action item to add a not vaccination on file section, but a vaccination records section that was discussed yesterday with Elizabeth. I have not implemented that, correct, President?
Correct. I don't.
Because that discussion that happened in Discord yesterday had to do with the collection of records that the individual may have brought with them regarding previous vaccinations. And we wanted to get those previous vaccinations only if they had clinical records of them into our system. So the president said it's not good enough for them to say, I've gotten my first hepatitis shot, but I don't know when, I don't know where, etc. Well, that doesn't really matter. So we have to start over. And so it's different if they bring a piece of paper that shows, in fact, that they got it, when they got it, on what date, who gave it, etc. And so there is a section that needs to be added, which I have not added, and I need to take the action item for, which is to build the clinical, what were we calling it, President? Clinical vaccinations?
It was documented, clinic documented.
Clinic documented vaccinations or something like that. Mm-hmm. But directly below the vaccination files, on the ones on file. So the ones on file are the ones we recorded. The other ones are ones that the RN has seen proof from, and that is a section that's missing. So I need to add that as well. And then I need to allow a section down here for those to be added. I guess it would look like this, correct, President? Because it will only be for vaccinations.
The new vaccinations?
I'm sorry, the only clinical data that you're going to record is vaccinations. Is that true?
Correct. They bring that.
So if they bring you a slip that says I have cancer, you just check the box you just say up here, chronic conditions, you click cancer, and it goes into the line, you're good.
Okay.
But the only thing that you're recording regarding vaccinations are these clinical documented ones.
Right.
So clinical documented vaccinations will look just like these vaccinations with regards to what's in the, we'll just have to define what's in this drop down. This drop down will be different for the clinical vaccinations. Does it include things like polio, meningitis, measles, etc.?
Yeah, and then you can take away the site. That won't be necessary.
The site won't be necessary. It'll just be the vaccine, the dose number, and then that'll be it. Mm-hmm. And then that will show up here in the record summary. And then you can see under the summary, I've made it so that the labels are all present, so we can see when people are overweight, what a normal temperature is. So these are red flags or green flags or orange flags or yellow flags for the RN or anyone looking at historical information to know this condition was not normal, basically. And those are all created by based on scientific data from the World Health Organization and other ANSI standard organizations. So, and you can see here what supplies were given. You can see the follow-up was requested in this visit, and the public notes and the private notes. So the private notes will come up here. So if table 1 types a private note that says, recheck blood pressure seemed abnormal, then the scribe at table 2 will see that private note only and recheck the blood pressure maybe at table 2 before giving the vaccination.
Potentially, but they won't have those.
They might not have those capabilities, but that's just an example on how the private note goes from one table to the next, whereas the public note is just that as a public, that the person is stable, etc. So these are previous these are only the last 3 encounters that we're displaying in this section. That was for the Presidio medical background decision that 3 was a good number there. Right. So then these are the diagnostics. So date of birth. One thing I didn't put in here, I need to take the action item to add to calculate the age of the individual. There's no reason we can't do that based on the date of birth. And so I might as well calculate that for the RN as opposed to having them need to calculate the age. So I'll take that as a third action item on modifications to the tool. To the Shield app. And then, so that comes down here, the phone number, the ID, this is required. Hopefully we all now understand the impact of the height and the fact that on the card it's printed, which means that the card has to be essentially present for them to share their public records. That's acting as the PIN or the passcode. So we don't have to give them a PIN, a passcode, or yet another card to keep track of to access their data. That was Warihana. Ben, you understand that as well? Great. And so these are the known allergens. The chronic condition, I think Warihana, this takes care of the diagnosis, quote unquote, thing that you were looking for, so we can identify who has cancer, who doesn't, but we're not necessarily diagnosing them with cancer at our event. So that's great. Some of these recommendations regarding the allergens and the chronic conditions, as well as the way that we flag these, all came from a doctor that I'm working with in Tamale, who we visited with Ben actually when he was feeling ill. And so he had given that advice, and or it was Presidio, whoever went to the doctor. We went to the doctors several times. One of the doctors there, whom I built a relationship with on WhatsApp a little bit. I've been discussing these things with him as well. And he had given that feedback and has seen these changes and the current version and feels it is excellent. He said it's very good. So I feel good about that as well, that we actually have not only nurses are very important. We all know that, but we also do have a doctor looking at this as well to make sure that they have what they need when the patient records are pulled up, that they have what they need to actually help treat, should they need to, in the future for this individual. So then we talked a little bit about the pulse ox, and we have the need for some things to be at the tables. So row 1 of the table, row 1, we need the blood pressure cuffs, obviously. We need the temperature, the thermometers. We need a simple tape measure to measure height if they don't have a Ghana card, because we all know that we don't enter the height unless it's printed on, unless they have no Ghana card ever. If they have a Ghana card and they've forgotten it, don't enter the height. If they have a Ghana card and they have a height, don't enter the height other than what's on the card. If they have no Ghana card, enter the height, because then it will help calculate the BMI. And when they get a Ghana card, that height will be put in there. This assures them that anyone with the card can have access to their medical records through that PIN or password of height, which is printed on the Ghana card. Does everybody, Warihana, do you understand that? Great. And Ben, you do as well? Great. And Salam? Salam, you understand the importance of the height on the Ghana card? Great. That it acts essentially as the PIN or the password. Perfect. So going back to the things that we need on the table, the other thing I think that we identified was a pulse ox. Pulse oximeter. And so those we do not have. Just real quick, Ben, kind of just because you're in the office and you kind of handle the inventory, is it true? I think, and correct me if I'm wrong, Salam, in row 1, you're planning on having 10 tables. Is that correct? Great. So, Ben, do we have 10 blood pressure cuffs?
No.
No.
I think what we have isn't up to 10.
Okay. So let's just, do you know that count here, Salam or Ben?
I think now we have up to 5.
Okay.
We have 3. We got two donated by Khalifas.
Great. So, Salam, does Khalifas provide these to us, or do they sell these?
They donated 2 to us.
Yes. But
Yes.
but do they also sell these?
Yes, they sell them.
Okay, great. So we can go back to Khalifas with the number that we need, which I'm going to confirm with Ben as well, is we need 5, right?
Yes. So I can actually confirm 3 in the office here. So with the 2 Khalifas is donating, that's 5, and we'll need 5 more.
Okay. And Salam, did you receive the 2 donated or not yet?
Yes, it was sent to my shop.
Okay, great. So Salam, maybe you can go back to Khalifas and ask them to donate 5.
Or help with that possibility.
Or help with 1 or whatever. Ask them for an additional donation or with the pulse oxes. But regardless, we need to just purchase from them on our credit 5 additional blood pressure cuffs and 10 pulse oximeters. So whatever you can get them to donate, great. And if they can't donate, then that's okay. We'll just buy them from them because they're a medical supplier and they sell them. You agree,
Okay,
Salam? Salam, you're wait really quick, Ben, before you go. Salam, you're good with that?
Yes, I'll find out from them if they have. I'm not able to mention the second item you mentioned.
The pulse oximeters?
Yes.
Okay.
I'll find out if they have them, and then I'll find out the price.
Okay.
And we can get them.
Okay,
So
great.
we'll need 10 of that as well.
Yeah, 10 of those and then 5 of the blood pressure
Okay.
cuffs. And Ben, what did you have on that?
I wanted to ask about that item again. I think we just say that thing for measuring pulse because the name is too technical to mention.
Oh, okay. Yeah. Okay.
Yes.
Say that again, President.
Pulse ox.
Pulse ox.
Yeah.
Okay, pulse ox. Is it just used for measuring pulse?
It has pulse and your heart rate.
Okay, because I can. Okay, I can see that from the past events. Though we were using just this, I don't know if it was some of our BP apparatus that were able to also measure the pulse as well, because under the blood pressure, for some of the medical records, they put pulse there.
Yeah, the difference
with the blood pressure cuff, that is the pulse or the heart rate as well. With the pulse
Okay.
oxes, that gets the oxygen that's in their blood as well as their heart rate too.
Oh, okay, all right.
So it's actually if you're looking at my screen, it not only provides the pulse, but it also provides the SpO2, which is the percent oxygen in their blood.
Okay.
Does that make sense, Ben? So it is a different tool than the blood pressure cuff, but it's good that you checked.
Okay, that's fine. Because I was thinking if we needed to measure just the blood pressure and the pulse only, then that's what I was thinking, and we wouldn't need that because the other ones are able to measure the pulse of the heart as well.
Right. Yeah,
Okay.
no, I think that if you look, the president just put in there what a pulse ox monitor looks like in the chat.
Okay, yeah, I see that. I think I've seen that in some hospitals. Yeah.
Yeah. So
Okay.
so this is to measure the oxygen in the blood.
All right, that's fine. Thank you.
Yeah, and so we'll need 10 of those and 5 BP blood pressure cuffs. And Salam's taking the action item to get prices for all of those. And Salam, those will go on a second. Salam took one purchase invoice action item for the soap, as that'll be paid to him. But then he needs to create a second purchase invoice for Khalifas for the pulse ox and blood pressure cuffs, based on how many he can't get donated. And Warihana is taking a purchase invoice for herself for the charger. And that's against the office project. Is everyone clear on that?
Yeah. What about the tape measures we spoke of?
That should go. The tape measure. Warihana, you are a seamstress, so you surely can get access to a tape, not a tape measure. What are they called?
The tape. I'm not a seamstress.
A measuring tape. Yeah, measuring tape, I think it's called, right? Yeah, measuring tape that we can use for measuring height. Warihana, can you get 10 of those?
Yes, we should be able to get those and buy.
Okay, great. And so if you get those, Warihana, you can include those on your invoice, purchase invoice with the charger, as those will be office expenses.
Okay.
Great.
And what about the scales?
How are we doing on scales, Ben?
Well, I think that's another important thing. From the last event, we had just 2 scales, and I think one of the volunteers brought a scale, which she took back after. But we have just two scales. Salam, am I right with that? I'm just checking now, but I want to confirm. Okay.
Yeah.
Yeah. So we have 2.
Yeah, so we need to buy 8 scales. So Salam, does Khalifas sell scales?
I don't know for a fact, but I think they should sell scales because they have, they should sell scales. I think. Well, they sell a lot of they sell a lot of medical supplies.
Yeah, that's what I figured. So Salam, if you could check with them, we need 8 scales as well, and maybe they can donate some of this stuff. Okay. Great. So Salam is going to take the action item for Khalifas. And are you good now? Each table should have everything they need. Great.
Yeah.
Great.
Okay. Back to the app.
Yeah. So
I
then
think,
go ahead, Salam.
yeah, I think with our new parts, I think that is actually a very good idea that we are getting all of these things line up. I think that would make our events very easy going forward. Yeah.
Yeah. Yeah, for sure. I think that, what we're trying to do is streamline it with removing the paper element and having Starlink there and having the Shield app, and then also streamline with the weight and the number of scales, the number of blood pressures, the pulse oxes, all of these things, I think should help us streamline. And my hope is that after we do this event and we have this additional setup and the new table structure, row 1 and row 2, I'm hopeful that we can increase from 800 to 1,000 at the event because we streamline. But I don't know if that'll be possible. But that's my goal, is that we'll be able to go back to 1,000. But I think it's good that that we get these items because and I think it's important, Salam, Ben, Warihana, that, and I don't expect it, but we just need to make sure that when we return off of the bus from the event, that there are 10 scales, there are 10 blood pressure cuffs, 10 pulse, that we collect everything that was at the event that was ours, because we'll clearly use it again. And that's why I don't feel bad investing in it. We're going to use this from now on. This is the way we're going to do our events. And so there's no reason not to buy 10, have 10 scales and blood pressure cuffs, et cetera. We just need to watch the inventory and make sure that it all returns back to the office and it doesn't get misplaced or lost or nicked.
Yes, that's true. Yeah.
Okay, great. So then back to the interface really quick. So they'll record the testing, positive and negative on the tests. I don't know, President, if you want to take a minute to discuss what you found on the testing, the triple test.
Yes, so I did. I was able to find a manufacturer here in the States in New Hampshire, I believe. And I reached out to the individual, asked about the cost of the tests. And from this provider, they're $15 a piece. They use it mostly for research. And so if they're in a situation and they need to do a 3-in-1 test, then they'll do it. So it's not necessarily obviously a price point for us. And so my plan is to respond to the woman. It was the founder of the company actually that had responded to me, and just try to negotiate, maybe work on possibly getting, a cheaper, less expensive test, or maybe she has an idea of where we could go. So yeah, I'm working on that. Hopefully, fingers crossed.
Yeah, and we did the calculation this morning based on our current test kits, and we ended up at about $2.60 US for the 3 tests, the hepatitis B, hepatitis C, and HIV total. And so at $2.60 versus 15, that's not even close. But maybe there's something that she could do, or defer us to the manufacturer, or
and it makes sense why it's not available there in Ghana.
Yeah.
Yeah, I think I also did some search on it, and I found the same prices. In Ghana, I think it was even higher.
Really?
In Ghana, I think I mentioned them to Warihana. I don't remember, but it was higher. It was about $25 to $50.
Wow.
And it just didn't make sense for me. And just like the president said, they said that it was mostly used for research purposes. So
interesting.
I
Well,
think
good
that's
work
why
on
the businessmen are not going into it.
Yeah,
Right.
good research from both of you on that, and hopefully we can get these produced for outside of research purposes, because it seems very simple and much more practical. So you know, with regards to simple for testing, simple for reduction of blood biohazards at the events, etc. So yeah, so good work on that, and I'm grateful that we now know that you know, we're doing it the most cost efficient way, which is what's most important to me, because that means we can do more events. That means we can do more vaccinations, et cetera, et cetera. So great work on that.
And for me, it's the matter of safety as well, with how the nurses are drawing the blood and doing the testing now. I just see a liability for accidental needle sticks, and so that makes me nervous as far as when the labs technicians or the nurses are drawing the blood. So that's why I saw this and I was like, oh my gosh, one drop of blood and they can do it all. That's amazing.
Yeah.
So I'm still working on that to see what else we could provide and stuff, different supplies or whatever. So, but yeah, work in progress.
That's good. That's good. Good work. All right, I'm going to continue down. So then we have a new section that Warihana helped me flush out, which is supplies and services given. So here we have multivitamins, which sometimes we give out because they're donated to us. We have the deworming, the condoms, the malaria treatment, which we've done sometimes in the past, strictly treatment, no testing. The pads, the antibacterial soap, and the wound care. And the one thing that I wanted to touch on with the wound care is that wound care is not part of our event going forward, as it's not part of the funnel. But just like the multivitamins, sometimes we do them. And I want to just make sure that the group is in alignment on that, and make sure that Salam, you agree with that, and Ben, Warihana does, great. Salam does, and Ben, you agree? Great. Okay, so even though we sometimes do it, it's not part of what we're focused on when it comes to the funnel. So then under new vaccinations, this is where they can record the vaccinations that are given. President helped me on that, making sure that we have selections for right arms, left arms, etc. The follow-up and referral checkbox, and then these are the note sections. And then they hit submit, and they're all good. They go to the next person. So I have some changes I need to make there on that. But before I finish up, I want to go ahead and show you the patient portal side. So if you continue to look at my screen, you'll see this is where we're going paperless, as Warihana put it. And we're definitely not trying to print papers or write on papers or any of that, because it is a slowdown. It is not environmentally sound, and papers get lost, and et cetera, et cetera. So this patient portal is for Ghana ID patient card patient ID holders only. So you can see down here's the cheat sheet. This is essentially the number from the Ghana ID card. The Ghana ID card will just be, our card number will be entered there. Once it is, we use the weight, the height, which is also printed on the card. That's their security code or their PIN to get access to these records, so that you can't guess it. So this is the case where an individual, I see this as where a patient wants to see their records personally. They would use this because they have their Ghana ID card. They can easily go to this site and do this themselves. But it's also when they go to a hospital, they can give their Ghana ID card over, and we can make it known to local hospitals that this patient portal exists. And if they put in their information, they can pull up this patient's past information that we've collected. And so let's just pretend for a moment that we're a doctor in the area, and this patient has now been referred out. They can see, this is John Doe again. They can see John Doe and his records and what was performed. They click view records. When they do, they see John Doe. They can see that they were tested positive for HIV, that they were referred, that they're allergic to penicillin, etc. These are the medical encounters that we've seen them for, the vaccinations that we've seen them for. There'll also be the section here for clinical documented vaccinations that I need to add, and then they can see that there's the dependent as well. So, and then these are all flagged as high, high or concerning, they're colored, etc. And I need to add here up into the section here under the records for John Doe, I need to include the calculated age as an action item. And so basically this is how we're providing our medical records to everyone. If we, so with this, they can always see their medical records or someone else can see it. And it's not guessable because essentially they have to have that height that is printed on the card.
Beautiful.
Yeah. And so that is how we're going to go forward with the app. Looks like the President agrees. Ben, do you see anything that's concerning or that you'd like to see changed on either the portal or the Shield app from your side?
Nope. I'm all good for now.
Okay, great. Salam, do you see anything that's missing or that you'd like to see in the app or in the portal?
I'm all good.
All good. Okay. And Warihana, how about you?
Kevin, I'm all good.
Okay, great. So, and President agrees?
Yep.
Okay, great. So at that point, I'm going to take the action items that were discussed in this meeting and finalize, that'll finalize this version of the Shield app and the patient portal, and I will build the backend system out in the coming days in preparation for the actual logging of information. The only thing that I wanted to confirm here, and Ben, you can give some insight, is once I revise the interface here, will this serve, and the President can, everybody can comment, will this serve as a good enough training environment for all of our nurses and nurse scribes? Or do I need to somehow build a system that they can actually, so when I go in and say a new dependent, if I fill this all out and hit submit, it says, yeah, go ahead, you can do that. It shows what's required, okay, but that the date is not actually saved anywhere. So if I enter a new vaccine, it's not going to show up as a vaccine here. Is what I want to know is, I'm sorry.
Or maybe
it's not refreshing or something.
Maybe now you're there.
It's caught up. Okay.
Yeah.
So if I enter a new vaccine in this interface, it will not show up under here. However, everybody can see what it's going to look like. And is what I need to know is this static HTML page that we're using as a pilot good enough to train the RN scribes, which I've shared this with everybody in the group. I can show the final version there. Does this serve as a good enough training tool for all of our RNs that are going to be in the field who are going to use it? Or do I need to build a system that actually saves the vaccination and shows the vaccination that was just saved, etc.? What happens with this? Ben, can you comment on this? Are we good with what we've got, or do I need to build something more for testing and training purposes?
I think we would be good with this.
Okay.
Yes. So what we are actually looking at is, though it is shared there, but we would meet them and we'll discuss one-on-one if they have questions to ask about the app and how it works. Then they bring that up before the actual event itself.
Yeah. And this is kind of what I envision, and maybe I'm wrong, is that I envision Emmanuel, yourself, maybe Warihana and Salam, all having a meeting at the office with the individuals that are going to be at the event, and then having them bring this up on their phone as a training tool or as a pilot project, a pilot tool, and then answering, as you said, any questions they might have in a organized manner. I don't know if that's
maybe that's a meeting done at a time that's convenient for you, so you could be on call or possibly.
Sure, but I can tell you that once we sign off on this, I'm not changing it until the next release. So that's why I won't be making changes.
Yeah, and I'm not saying be there for making changes,
but I'll be able to answer questions.
Exactly.
Sure, I'm happy to do that. But just to be straight off the top and 100% transparent, no changes.
Okay, yeah. So I think we'll be meeting them before the actual event.
Mm-hmm.
So that would be an opportunity to get to let them know where we are going with the new app and how we'll be taking data. And I'm sure the questions will come up there, and we would find a way of addressing them.
Okay, great. And so,
Yes.
So you see that as an opportunity. So somebody, because I'm terrible with dates and times and things like that, and you all know that, and you can laugh at me, that's fine. But can somebody tell me what the date is for the event and when you plan on having that meeting, Ben?
I think the date for the event is 27, so we have some few days more.
Okay.
But for the date of the meeting with the RNs, that has not been decided yet. But I'm sure that will be somewhere next week. Yes, I'm sure Salam will communicate that with them.
Okay.
Yeah.
Okay. So I have less than a week. I have a little over a week to build the rest of this, to actually make this work. Because you realize this doesn't, this is just a prototype. There's a lot of work still to be done. Like the actual software has to be written. So I'm hopeful that I can do that, but I'll be working diligently on it and to actually get it functioning so we can record data for the event. But now that we have the no change rule in effect for the app and the portal, I'll be able to do that. So Ben, I will have this final version mocked up for you to use as a training tool, and Salam at the event with the nurses in the office, and that will work for you. Agree? Okay, great. And Salam, do you see this is your agreements too? Great. Okay, thanks, Salam. So this will be the only training tool. So I will not build out any additional. The only system that I'm going to build out is a production one. This will serve as the training tool for how to use the app, and it'll reflect the changes discussed in the meeting. Perfect. Because that saves me a ton of effort. So I don't have to build a whole nother test system.
Excellent. Okay.
Great. So that was all that I had, and I will stop sharing.
Thank you. I will take it back over. Let's see here. All right. Looking at the active projects, we'll go ahead and run through these. I know, Warihana, you're driving, so I'm not sure exactly if you'll be able to see, but I'll just go ahead and run through them. The trademark, I believe we're still working on that. So that's continuation in progress.
Yeah, that's dependent on the board meeting.
Perfect. And the menstrual hygiene day, Warihana, no, 13. That's one that I went ahead and closed. So number 13.
Oh, I'm sorry. Could you refresh this? Do a Control Shift R. Yeah, this should be updated. Sorry. Yeah, reload this. It's gone now. The page was cached. Apologies. Yeah.
Gotcha. Okay.
Yeah.
So there.
So now we're looking at grant 16.
Presido.
Yes.
Do we have any other thing on the agenda so that we go to it? I'm buying prepaid. The credit in my house is finished. In the next 2 minutes, I should be seated in the car.
Okay.
Otherwise, okay. Otherwise, maybe we'll just go ahead.
Okay, that's fine. So no updates for any grant projects. That's excellent. Thank you. Just scrolling through. I think the only other project.
There's an update on ABC, the hepatitis B.
What grant number is it?
Number 11.
Yeah, that's
Africa.
11.
Okay, 11.
Yes. So 11. As I mentioned, they allow people to join the coalition, but then there's a grant opportunity that opens in July. So when we submitted our form to join the coalition, we've been successful. So I don't know if the emails they've been sending goes to my email or the info email, but we are now part of the coalition, which means that when opportunities come up, we will be part of the first group of people to hear about it. If
Beautiful.
there are grant opportunities available, we'll be part of the first people to be considered. So I'm even considering listing them as one of our collaborators on our website.
Yeah. Yeah, I think that would be great, Warihana. And I think that this is critical because if we could even get them to donate the $2, the vaccinations for the event or the test kits, both of those
Yeah.
or even one of those, that will save us a ton of money.
Right.
Yeah, no, that's
Yes.
beautiful. And I think listing them is a good idea.
Okay. All right.
Great. Thank you for that. Great effort.
Thank you.
Uh-huh.
The next projects are just the ones for Salam, so we'll go down to project 4, which is upcoming.
Yeah.
Any other updates for project 4, Salam? I know maybe you're out in the field, or I saw the wonderful pictures the other day.
How did it all go?
Yes. So with project 4, we're almost done with the hydro siting because we've done 9 so far.
Great.
Wow.
Wow,
Just left with
amazing
one.
work.
And we're also going to start the drilling this weekend, hopefully Saturday.
Great.
So also we are left with the just the medical supplies, receiving the medical supplies. I've not bought them yet, but I know that it's within Tamale. So and with Lizzie's help, we can get that on Monday or Tuesday.
Mm-hmm.
And also, I've asked Ben. I had a discussion with Ben, I think 2 days ago, and he has decided to take the action item to call out for volunteers for the event. So what we decided is that we are going to take 44 volunteers from Tamale. That's what the 2 vehicles can carry.
Okay.
And then we'll take 6 from Gushegu. But as I understand it now, so we'll take 6 and we'll take maybe 2 physicians from Gushegu who can administer the vaccines. So 8 in all from Gushegu and then 44 from Tamale. So we've decided that we'll make a list from 1 to 44 so that the volunteers on the volunteer platform will just fill it up once it hits the number 44 so that we don't have more people registering and then we now being confused with who to go with and who not to go with, who to drop and etc. So once they fill the list, if we are looking for 44, so if you try completing the list and you see that we've met the number, you just wait for the next event.
Yeah.
So that's what we've decided to do. I think he will be sending the message out on the platform very soon. And once we have that list completed, then we'll set a date to meet within next week at the office to have a debrief before the event date. And with regards to the community,
I've informed them about the dates when we went for the hydro sighting. I told them as well, and so they are waiting when it's left with exactly 7 days to the event. Then they can go around the nearby communities and inform them as well. And then a day or two to the event, they'll get the gong gong beater to make announcements within the community. And for this particular event, we are looking at commissioning the borehole right after the event or during the event, during the screening exercise. So we are doing all of that at once for the
Wow.
Bambuli community. Yeah.
Wow. Great
So
work.
that,
Wow.
yeah. So that's where we are at with the projects.
That's beautiful. What such great work. Super happy and super excited that you've had the resources that you need to complete those tasks. And great job doing them, getting those things done in such a short amount of time. Excellent, excellent work by the whole team, as well as you, Salam, on the ground, coordinating, etc.
Yeah, definitely. That was great work. And two, it showed the community that we're true to our word. Yes, we are going to do the health hub. We weren't able to, and you told them, what our next plan was with the borehole and the medical event, and within a few weeks, we're bringing true to that too. So excellent work, very good.
Yeah, I think that's really important and honorable work that we're building those relationships. Excellent point. Ben, I wanted to touch base with you on how you were going to do the list um, for the 44 volunteers. Can you explain how you're going to do that, just so I can maybe help you manage that through I was thinking a Google form might be best, but I don't know what your thoughts are.
Yeah, so I think most of them, we have them on the WhatsApp group.
Uh-huh.
Um, so what we intend to do is just to drop the number. Each person copies the list. Mostly here, that's how we're able to get people. Each person copies, he inputs his name on number one. The next person copies it again, inputs his name on number two. So from the chat, you're able to see how people are picking up the slots. So at the end, we arrive at the last number, and
I
that
see.
is it. Yeah.
Because what we can do, Ben, is we can just build a Google form that accepts 44 people, and then collect their name and phone number, and then when it hits 44, it'll just say we're full. And
Okay.
you could just send that form out to the list and say signups are ready, and we can gather. I think you're just gathering name and phone number. Is that correct?
Yes.
So I could
Okay.
Oh, go ahead.
Not to
Yeah,
give you
that works too. But I think the group, I was thinking that people get to know how the number goes, and they're able to complete the
Um,
form if they are interested in going.
uh-huh.
Yes.
So however you want to do it, I'm just telling you from a technology standpoint that Google Forms might be an option if you have a way to do it, or you think that the community is up for doing it a different way. I'm fine with that. I just wanted to
Okay.
share that usually, yeah, that we have that option to do as a Google form.
Okay. Yeah, I think that's nice.
Yeah.
Yeah. Thank you.
Yeah, for sure. And if you need help with that, let me know. It's pretty straightforward, and that just records it all into a spreadsheet. And then if you can limit it, and you could also have uh however you want to do it. Yeah, if you need help with that, let me know. If you want to do it a different way, that's great too.
Okay. Sure. Thank you for the help.
Yeah, of course, of course.
Okay. Anything else on project 4?
No, I don't think so,
Yeah.
Ben. Oh, go ahead.
Yeah. So on project 4, and also talking about upcoming purchase invoices, I raised an issue with regards to the exchange rate
Yeah, let's talk
that
about
we're
that.
supposed to address.
Good point.
So
Good.
I
Thanks for
think,
bringing that up.
Yes, we've had a sharp drop.
I just checked now, and we are at 11.2.
um, compared to what we have. So sometimes, if we have enough time if we have enough time, and then with the crypto, we're able to look at try to trade within the black market, that's peer to peer, and see if you get a good rate. But because there's some
form of a clamp down on
crypto and cyber crime these days in Ghana by the FBI, crypto rates are actually dropping. So I think that we need to relook at the exchange rate we fix so that we can be compliant. Because with Project 44, I'm still talking with Khalifas because they are taking the largest share of the money, and I've not been able to engage them so much because I've not had enough time from Saturday because of the field work. So I'm trying to engage them to see how best um, we can adjust and make the payments to them. But we need to look at the exchange rate we set on Smiley, and then find a more I wouldn't know, but maybe a more appropriate exchange rate because of
Yeah.
the
So
volatility we are experiencing.
yeah. So Salam, here's why I was a little confused. Is I see Warhana has a question. Let me just comment really quick. Is the exchange rate that you're seeing? I understand the exchange rate is the exchange rate. It's changing. It changes frequently. It changes every minute, technically, or every second, whatever the number is. But what I'm wondering is where the problem is. Is the problem when you do the budget, or
Yes,
is it when
so
you do
so
the purchase invoice, or is it both?
so with last month we had the exchange rate set at 11.13,
Right.
right? And so when we get with all the payments we did last month, you were able to either get 11.1, 11.2 sometimes when you want to change the dollars to cedis.
Mhm.
And then I don't know how we were able to determine that rate, but it was very sustainable throughout.
Mhm.
So now the
So
issue is that with the current exchange rate, with the budget, we prepared the budget using the beginning of the month exchange rate, which was at 11.72.
yes.
And then
So
at the time
the budget. Sorry. So the budget is at 11.2. I'm sorry, 11.7. It's now
sorry,
gone.
11.72. Sorry.
Yeah, 11.72. And that's
Yes.
the budget. That's the budget. And so the budget was approved at that price. And now
Yes.
you're saying that, hey, the budget's gonna so now you're going to actually raise purchase invoices at 11.1. You need to raise them.
Exactly.
And so now your concern is that you're
So
gonna
at the
miss
end of
the
the day,
you're
your
gonna miss
purchase invoices will be more. So at the end of the day, you will have more dollars on the purchase invoices than the budget.
yes, it's going to be the project's going to be over budget because of the interest rate or because of the exchange rate.
Yes, the
But
purchase invoices will be more because of the interest rate. So, for instance, if the project is 10,000 US dollars, you are likely to have the purchase invoices totaling at, let's say, 11,000.
yeah,
Just an example, because of
right.
the exchange rate.
And
So I was thinking,
really wait, so really quick. So if we define the problem is that the budgets were done at exchange were done and approved at exchange rates that are no longer accurate. And so you're going to raise purchase invoices. You have to raise purchase invoices based on accurate exchange rates. Now, my question is really quick so that I understand is when you try to raise a purchase invoice, and Ben, correct me if I'm wrong, Warihana, I still see you. 1 second. Ben and Salam, when you raise the purchase invoice today and you say the exchange rate is 11.1, when you do that, are you able to do that, or does it force it to 11.7?
It forced it to 11.7.
Okay, so that's the bug,
Yeah.
potentially. Is that now essentially the budget, regardless of we all can agree that the budget's going to miss because of the exchange rate. The budget's either going to miss high or low because the budget was approved in advance of the actual purchases. So it could go the other way, and it could go to 12.2 and the budget will be under. We understand that, we accept that. That's not the problem. The problem that you're defining is that when you go to raise the purchase invoice or the sales invoice, even, or Ben does, that the exchange rate is still based on the month and it's not based on the day. If the exchange rate was updated every day, it would be closer to what you need, correct, Salam? And would be more accurate. And would daily updates of the rates fix the problem? Or do you want to be able to manually set them on the purchase invoices and the sales invoices?
Okay, so for me, what I think will be ideal, and having consulted some other people on how they are able to fix exchange rates for organizations like ours, because we most NGOs deal with forex because they receive dollar values, and they spend in Cedi. Actually, because in Ghana you cannot spend, the law does not allow you to price or spend in dollars. So what I think would be ideal is to use some average and some averages. So for instance, look at the past performance of the exchange rate, maybe for 2 months, 3 months, even up to 6 months, and then try to take an average. And based on the current circumstances, you either add a markup or a markdown, usually between 5 to 10%. And then you have a rate you can work with for over a period of time, say maybe a month or 3 months. Because what happens when you make it a daily exchange rate is that you will have your budget have a different exchange rate based on the day you prepare the budget. Your purchase invoices will have a different exchange rate based on the day you raise them. And then the actual day you spend or payments are made might have a different exchange rate, and you are supposed to spend in cedis. So there would be those issues when it comes to exchange rate. Either you would earn more or you would run low, with actual payments. So what I think would be ideal is to get an average. For instance, I spoke to a consultant from a World Bank project who said that they have set their exchange rate for the year. They set their exchange rate for the year at, I think, 11.0, and they use historical exchange rate data to calculate and then add a margin of 5% because they know that the Cedi is mostly likely to depreciate than it is likely to appreciate. And so even with the appreciation we saw within the week, Ben was telling me that he's on some platform and people were complaining that the Bank of Ghana is deliberately twisting the rates because mostly it's unlikely that you see the exchange rate, the Cedi appreciating against the dollar that sharply in less than a week. So I think that averages will work better for us than setting the exchange rates on a daily basis.
Okay, let's hear what Warihana has to say.
Yes, I was going to say just what Salam said. So certain rates on a daily basis might not really work. And in my experience, I was just about to share my experience as well, working with some international organizations. Usually they also go with the averages. So they go with the average. So they could take last year or the last 6 months and take the average of that. Or they take the lowest and then mark it up by 1%, or even so they will mark it up so it will be plus or minus than a certain percentage. And then that becomes their rates for the year. That's what I was about to say. So Salam has said it already.
Okay, no, that's good. That's good feedback. So here's what I'm saying, and hear me out and see if this makes sense. Is so today we use the first of the month as our average, which creates our average essentially, right? I mean, if you look at it as we say, if you took a sum, we're just taking the rate at the first of the month. So if you looked at so here's what I want to just say is forget all the frequency of the updating. The budgets were created with one exchange rate. It's always, as of today, based on the first of the month. So if you create a new project tomorrow, it'll use the same rate that was identified on the first of the month. Right or wrong, doesn't matter. That's what the budget was founded on, is based on. So if we put all of that aside, either that budget got approved at that rate or not. If it got approved, great. If it didn't, it's fine. We adjusted it. But all of the budgets for the next 10 projects will essentially get approved. Because the only reason they wouldn't, I don't know how to say this. Go ahead, Warihana.
That was my hand from before.
Oh, sorry. Okay. Sorry. Your hand was still up. Okay. So here's the thing. Okay. So I just want to say blanketly, budgets are not actuals. So if budgets get approved based on exchange rates, they immediately become only a point in time for approval. So as the CFO, I don't care that the project was on budget or not, so long as I can point to what the reason was. If the reason was because we added bars of soap and that's what the president decided, I don't have a problem with that. I'm going to go to the president at the end of the month and say, hey, we got to scale things down, we got to scale things up, or we're even, we're good. Right? So for me, it's a thumb up, keep going. It's a thumb sideways, we're okay. And a thumb down means we need to slow down. So, but regardless, that has nothing to do with the budget because everything can be explained. It was the bars of soap that we didn't plan for. It was the blood pressure oxygen sensors that we didn't buy. It was the scales. If the president approves all of that, I can only give her the thumb up, keep doing what you're doing. The thumb sideways, we need to be cautious, or the thumb down that says you better slow down or you're going to overspend. So budgets are only estimates. So rates that were tied to budgets that got approved meant we were trying to do this regardless. We have no control over the rates. So once the budget is approved, it's just a point in time. We know things are going to change, whether they're over budget or under budget because of things like a rate change or an addition to the project, a purchase invoice that wasn't expected. Those are all just part and parcel of doing business. I'm sorry, could you mute Warihana? There's some background noise. Thank you. So the budget is a point in time and a decision to do work. What the reality is that the time at which we do work, conditions could change. Decisions can be modified. We could do 1,000 people instead of 800. We could do soap instead of no soap. We could do an exchange rate of 11.1 or 11.7. All of those things are at the time of execution, and those are all the costs of doing business, independent of the budget that was approved. So the budget is a guideline, not an absolute. We're not trying to match purchase invoices to budgets. We're trying to do a budget to justify expenses. Does that make sense, Salam?
Yeah, it does.
And
So
and,
if I
and
understand you perfectly, what you are saying is that, so I want to use project 4 as an example,
yes,
just to
please.
make sure I get you clearly. So assuming project 4 was $20,000 in when we're budgeting,
Mm-hmm.
and that was equivalent to, let's say, 200,000 cedis, which we
Mm-hmm.
needed to, we have signed an agreement to create a credit line for. And
Yeah.
at the time, we actually want to establish this credit line, pay for this credit line, to establish this credit line. We needed the same 200,000, but because of exchange rates, we would now need maybe 21,000 or $20,500.
Maybe
You
only
would say
18.
that is, you would say we will need to raise a purchase invoice for the $500 more because of the exchange rates differential, which can be verified. I don't know, is that what you are saying?
Yeah, exactly. But
Okay.
don't think of it. But don't think of it only on the going higher, because it could go lower too.
Yeah.
So for example, if we budgeted for hepatitis B test kits and we budgeted $2, I don't even know what the number is. I'm gonna just say $2 even because I don't know the actual number. $2
Yeah.
per vaccination. If we get them for 190, great. That's what we need. That just means we did better. But
And
we
we can
still
do
do.
more.
But yeah, we can do more. But if we get for $2.10, then that's the reality of what happened on the ground. The point is, the budget is a point of the budget the budget creates something that the president signs off on as work to do. The reality is, when we do the work, it could come under or over that. We could save money and get all of the soap donated, and there's no change to the project. Or we could get a grant from Warihana, who gives us all of the test kits for hepatitis B, and that decreases the amount of the project cost in reality. But what was approved is what the president signed off on. The president said, here's a budget. We all agreed the budget was accurate at the point in time for the work to be done. The president signed off on that work. Now, what happens in reality, we have to just deal with. Whether the exchange rate goes in our favor or against us, whether Khalifas donates additional things or not. We can't control all of those. So for right now, Project 4 has been approved. That's why we're only approving budgets sequentially, is because we may need to adjust. At some point, we might get to project number 7, and say we could only do 600 people. Adjust the budget. Or we may get to project number 8 and say we can do 1,000. We've got the budget for it. We've come under on all these other projects. We've got the budget. Or we've gotten donations or grants that allow us to. So the budget is a point in time that the president signs off on work to do. What happens in reality when we raise purchase invoices is reality. We really can't control that. If the president says mainstream that we need to buy soap, we need to buy soap. That's the end of the deal. There's nothing more to say. So if the president says we've got to buy the vaccinations and the price of vaccinations went up, so be it. It just means project number 8 is where we're going to see the impact. because project number 8 doesn't have a budget signed off on. Does that make sense?
Yeah.
Does that make sense, Salam?
Yeah. Understood. So
And
it's
that's
just like,
and one I'm sorry, one more point that I want to make is that's why I think maybe the interest rate, I'm sorry, the exchange rate isn't renewing fast enough, and it should renew every day because that's the reality on the ground. So rather than trying to do an average, the average is really for the budget, right? Instead, we're just using the monthly as our budget. But maybe we should have it renew every day. And the day you create the budget is the day that we're at. And the day that we raise a purchase invoice, it's at that day. And if we do a sales invoice and it goes down, so be it. We can't control it. So better to embrace it and say it's a changing aspect of what we do. The only reason we do the budget is so that the president can sign off on the work. And what the realities are once that work has been signed off on is we try and save as much as we can. We hope the interest or the exchange rate goes in our favor, and we try to save as much money as we can on every project or get as many grants as we can so we can do more in the future. So in that case, I would say that's why I came back with, I don't think it's refreshing. It needs to refresh daily, I think. But I don't know what everybody else thinks. President, I want to ask if you have any insight as to or understanding of where we're at and what we should do.
Well, I appreciate the explanation. Very thorough, very complete. That's wonderful. I agree that we should probably change it to adjust every day. But having you explained everything, that makes sense as far as like it is what it is and things happen. And
yeah, we're dealing with Khalifas could come back and say, look, I love you guys, but my cost just went through the roof and I need to renegotiate. Or they might come in and say, hey man, I just got a smoking deal and I can cut your price by half. And we say, great, give it to us. We're not going to pay them, what the budget says. We're going to pay them what reality is because the president signed off on the work. And that's why she didn't sign off on 5 yet. It's because we don't know where we are after 4. We're going to find out after 4 is complete. Then she'll sign off on 5 and she'll say, we're going to do 1,000 people. We're going to do 800 people. SOAP is in there. SOAP is out of there. She's got to decide that. So does that help, Warihana, with your understanding of how we could do it?
Yeah, I think your approach is great. And like you said, so we would have budget and then we'll have actuals. And then we would have variations. So we could have a negative variation, a positive variation, or 0 if our estimation was correct.
Yeah.
And even right now, our budget is even flexible because the SOAPs is a newest idea that we just thought about.
Yeah.
And if it's approved, that's going to be an addition to the budget. So yeah, I think your approach is great. We can go with that.
Okay, great. And you agree that dailies are probably the best way to do it because when we raise a purchase invoice today, we're paying it today's Cedi, not yesterday's.
Yes, that's great. So we use today's rates, and then the moment the money is paid to you, you sell it. And in that case, you still get the money in today's rate.
Yes.
And what we are concerned about is the Cedi value.
Yeah.
So if you sell it today, you get the expected Cedi value.
Yeah, exactly. Okay, great. Thank you for that, Warihana. And Salam, how do you feel about this?
I think it's okay, and I think that solves my problem with Khalifas, because then we know the amounts of money we have with him for our credit line in Cedis. And just like you said, from the last event, we did have some savings that is reducing the quantity of hepatitis B vaccines we'll be buying, and I think some other item like that. So for instance, for Project 4, I know we might be buying 700 doses of hepatitis B because we still have 100, and we'll be buying, so that will reduce our cost. And so I'll just order what we need for Project 4, order what we need for Project 5, and then get the receipts at the same prices. And at the end of, let's say, Project 8, 9, or whatever number we get to, and we know that our credit line is exhausted, and then we can account for, if there is any difference, we can account for that difference, and that difference, if traceable to the exchange rates, that will be justified, as you are saying. And
So
that will apply.
So for example, like, I'm not saying the budget's not warranted. We need the budget and we should try to stay on track. But if things change outside of our control, like the president decides she wants to do soap, then the president wants to do soap. There's nothing we can do. But if we try to stay on budget with everything, and like you said, things are going to fluctuate. So with Khalifas now, we're talking about buying 10 pulse ox devices, and we're talking about buying more blood pressure cuffs, and we're talking about buying more scales. The goal with Khalifas is to get 10% on everything because we're buying so much through them. So when they give us a price on the scale, your immediate response is, can you donate that? And when they say no, then you say, well, surely you can give us 10% because we buy so much from you, right? And then we buy it from them, and we buy it on our credit line. And at the end, I think the key is that the thing that is missing is that the work that's been approved is Project 4. We're not even guaranteed that Project 5 is going to happen. Right? I mean, we know it. We're planning for it. We've set everything up. We're expecting it. We're going to update that budget when the time comes, because things like soap are missing. Maybe the number of people goes from 800 to 1,000. Maybe it goes from 800 to 600 because of our budget. Maybe it goes to 200 people we can only serve. I hope not. I hope it goes to 1,000. But the only way it goes to 1,000 is if we have the money. So we plan each. So it's do the budget. President approves. President approves. We execute based on whatever exchanges or whatever the president wants, based on that budget, and we try and save as much as we can every time, whether that's negotiating with Khalifas or any other supplier who we might get the measuring tapes from. Any supplier, anything. We save as much as we can. Then we look at project number 5. But before we do project number 5, we do, and this is the part that's missing and hasn't been talked about, is we do a debrief on project 4. We say project 4 had a budget of this amount, 20,000. Why did we go under? We went under because we had vaccines donated. What did we go over on? We went over because we had bar soap that we added, or we went from 800 people to 500 people, or 800 people to 1,000 people. We do that. It's called postmortem, but we do this evaluation of the project before 5 gets approved, and we say, what did we do good? What did we do bad? Where did we spend extra money? And where did we save money? And if everybody points to the exchange rate and says we lost 10% because of the currency rate, there's nothing we can do about that. We just have to figure out if we can still afford Project 5 or not, and how we need to adjust 5. And hopefully we always adjust 5 to help more people. Ben, what are your thoughts on that?
Yes, I agree with all that's been discussed. Exchange rates will not always be fixed. So it's good we actually create an avenue where we would have it going about on the budget or going below what we had on the budget. So I think because probably we're looking at this was the budget, we have to comply with everything that was in the budget, even though circumstances might have changed, but we're only looking at being strict to the budget. But if we can be flexible, because for most of the events or most of the things we are yet to acquire for the next projects up to project 5, project 6, 8, the budget is already there. So as at the time of execution, aside the credit lines we have established, the time of execution, if the exchange rate is, there's a vast difference between what we have on ground and what we had on the budget, then it will definitely be a problem for us. But we understanding that we can always use the current one and not just try to stick to what we had in the budget is I think that's okay.
Yeah, so I think that to think of it as the only budget that we're working on, and we absolutely want to come in under it, is the budget that's been signed off on, which is Project 4. If we cannot, for undue circumstances like exchange rates, additional requests like bars of soap, all of those things, then we just have to adjust future budgets. And those future budgets are kind of like recommendations, right? Because we literally did copy them and said, we're going to do this at all of those. Now, financially, that might not be possible. We all know that because things change. But we have to do the project, evaluate where the project landed, over budget, under budget, and then adjust. Hopefully it comes under budget. And then the next event, we say, hey, let's do 1,000. And then we come under again, and we say, let's do 1,500 people, or let's add a project. Whatever it is, hopefully it's going in our direction, but we also understand we don't win all of them. On this project, the exchange rate might be against us, but by the time we get to project 8, it could be in our favor. It could be 12.5. But that's just the reality of where we're executing. Does that all make sense?
Yeah. And just like I said, and as you are emphasizing, let's hope that it will go in our favor, because our city is used to depreciating. It's not used to appreciating.
Yeah.
Unfortunately, we are trying to attract foreign investment. So the finance ministry and the Bank of Ghana is performing some magic. So probably that's why it's affecting us right now.
Yeah, for sure. And we've seen this, and it's going to continue to affect us. So these are the things that we have no control over. And I think, we have to we have to negotiate every transaction with every time, whether it's for, tape measures, for scales, pulse oximeters, blood pressure cuffs. That's why I say go with Khalifas, right? They've already committed to 10%. Let them commit to 10%. Then we don't have to negotiate. We just have to say, and that's a 10% discount on that, right? That's easier than going to a new supplier and saying, hey, we need 10%, right? We've already gotten the 10. Let's stick with Khalifas. And if that allowance runs out, well, the reality is we got to put more on the allowance if we want to do the work at project 6, right? So we just better we stick with our suppliers that have given us discounts and are making donations to our efforts, and continue to negotiate every place we can for every dollar we can, because we know every dollar we save in the current project means we can do more in the future projects. So I will take the action item to adjust the exchange rate to daily, and you'll see those change daily, Salam. So give me, it's a scheduled job. I don't know what time it runs, but give it 24 hours, and when you raise purchase invoices, it'll be adjusted. Great.
Wonderful.
Good discussion, and that's why I didn't want to discuss it in Discord. It's very complicated. So I'm glad that we took the time to do it now, and glad you raised it, Salam.
Very good. Anything else on Project 4, Salam?
No, that's all on Project 4.
Okay, excellent.
So I have one more question on Project 4 before we move on, and that, Salam, how are you feeling about your confidence level to be able to deliver on the 27th?
70%, maybe to get to 90 by next week.
Okay, and what's your biggest concern? Is the well or is other
Yeah.
things?
Yes, my biggest concern is the well, because I think I was just telling Ben yesterday that and the concern with the well has to do with the concrete work, the time it is done, and the time it dries.
Mm-hmm.
Because usually what I do with our boreholes is I give it a week to make sure that it dries well.
Yeah.
So that we fix the hand pump. And so now I would say what will make that possible is to make sure at least by Monday Project 4 is drilled and concrete work can be done on Tuesday, so that then on the day of the event, what I'll do is to go with the engineer on the same day.
Mm-hmm.
And whilst we are at the medical event, he's fixing the hand pump. And when he's done, we all just gather around it and commission it. So that's what I'm thinking.
Okay,
And,
well, just so you know, I mean, we want to work, smart. So if the cement's not going to be dried, then just push it to the following week or the following whenever, because we don't want to have, we want the quality work. We don't want the pump cement to crack or have to go back and redo it because it's rough. So better we take our time and let things cure than to rush it. Just so you know, that's my opinion. I think that's yours as well, President.
Yeah, no, I agree with that 100%.
Yeah.
So I agree too. Yeah, so that's why I am bent on at least giving it a week.
Yeah.
So like I said, it will depend on the actual drilling, the actual date the concrete work is done. If we can't get it dried very well or before the event date, then we might have to commission it after the event.
Yeah. However you want to do that it's your lead. Yeah. Whatever you decide is fine with us. We just would prefer that we don't want to waste money. We don't want to have to go back and redo something. So keep that in mind. And yeah, that's great to know. Perfect. Thank you for that update.
Okay, excellent. That's all that I have for my agenda. Do you have anything else, CTO?
No, I would say I'm right there with Salam at the 70% mark as to whether the software will be ready for the event.
Okay.
Regarding the Shield app, 70%. I'm working hard, and I don't want to rush anything either. So we're going to do it right. And our fallback plan, like Salam has a fallback plan B, mine is to still go with paper, which I hope I don't see that happening, but because we're at 70%. But yeah, that's where we are.
Okay, excellent. Thank you for that. Warihana, do you have anything else for the meeting?
So some of the things that I worked on this week, I added them as projects, but I think they are not reflecting in the.
In the active.
Yeah.
Can you give me the number? Can you give me the number of one?
I don't know the number, but search for MTN.
MTN. Yeah, I have 15. Project 15. It's there.
Okay. So this week I went to MTN. And I met. So when I completed university, I did my national service at Ashesi. Whilst I was doing my service there was another lady working there. She's now with MTN. So when I went to MTN, she directed me to the foundation to meet someone. So MTN has a foundation that they do their CSR activities through. So it was that person that asked me to submit the form. And that was the sponsorship request that I put together and shared with you guys for feedback.
Yeah, it looked great.
Yeah. So fingers crossed.
Excellent.
Yeah, MTN has money, so and their request amount is open. So I just kept it to 7 projects.
Yeah.
And looking at the unit price of each project, currently the unit price is around 200 and something
I think 280.
thousand to what?
280,000.
Mm.
I can't.
I think
Maybe it was
yeah,
less.
minus the soaps is like 225 or something.
Oh, 25. Okay.
Yeah, and then just because we are now going to add the soaps, I just rounded everything up to 260,000
Yeah.
per project.
Yeah. Perfect.
Yeah, and then I indicated that for each project to reach 1,000 people.
Yeah.
Yeah, because they are looking at a project that can serve at least 5,000 people.
Oh,
So
perfect.
if we are doing 1,000 times the 7, that's 7,000, which
Yep.
is a good number for the amount that we are asking for.
Yeah. That's why I said I love every part of it.
Yeah. Okay. And then there's this foundation called Skoll Foundation. So
Yeah.
Skoll Foundation.
This is project 14. I see it.
Okay. So Skoll Foundation, they catalyzes transformational social change by investing in connecting and championing social entrepreneurs and other social innovators
Mm-hmm.
who work together to bring solutions that ensure equity in the world. So
Nice.
in urban areas, people are having good access to good healthcare, but that's not the
Mm-hmm.
same in the rural areas. So there's no equity in that.
Mm-hmm.
So they are looking at organizations that are trying to bring equity amongst everyone in the world. And
Mm-hmm.
there's the opportunity to submit a request to become their partner. Though they give grants, their grants open somewhere in September or December. But
Okay.
there's still the opportunity to become their partner. So
Mm-hmm.
become their collaborator, sorry. And by becoming their collaborator, it means that you can actually send them proposals, and then if it aligns, then they can sponsor it. Or
Mm-hmm.
you can just become like you become their first point of contact when grants or even opportunities come up. So
Yeah.
usually with the grant space, when you are able to get one grant from them and then you execute, you build credibility with them. And
Mm-hmm.
whenever they have projects that they are not even advertising, they reach out to these kind of organizations that have the credibility with them. So that's also something that I did. I submitted our request to be collaborators with them, and then
Beautiful.
I'm waiting
Perfect.
for. Yeah, so I'm on the lookout. All of these organizations, I follow them on their socials, and then I've
Uh-huh.
even subscribed to their newsletter so that when they open these grant opportunities, then I get to know about them and then I can apply.
Great. Yeah, that's perfect. That's excellent work.
Wonderful.
Thank you. I also
Yes.
Mm-hmm.
went to UNDP. UNDP has an office in Accra. And then when I was in Accra, before I moved to Tamale, I made clothing for people.
Mm-hmm.
So there was this guy that I made clothing for,
Uh-huh.
and I just remember that he's at UNDP. So I contacted him, and then he directed me to their office, and I told them about our project, and it's something that they are interested in. I wasn't really given a solid answer. They have grant opportunities that they open. They said they recently closed a small grant opportunity, but they will be reopening it soon,
Mm-hmm.
and they would reach out. So my friend will reach out. I even connected with one other lady there. She's their partnerships lead, and
Mm-hmm.
yeah. So when they open the small grant again, they will let me know. I'm following them on their socials as well.
Great.
And now that they know about my project, or our project,
Yeah.
when an opportunity for collaboration comes up, then they will let us know as well. I'm just excited at least I have people in the organization that can give me information if something comes up. So it's not because it's not everything that these people advertise.
Yeah,
Some
yeah.
of the things they just do them internally.
Yeah, absolutely. No, that's great. Although those contacts are excellent work, Warihana. Thank you for doing that.
And then, UNDP, UNICEF, World Health Organization, they are all kind of related. Yeah, they are all UN agencies. So the people at UNDP said UNICEF could be interested in what we are doing. So
Right.
I have not been able to visit their office, but I've connected with some people in the organization on LinkedIn.
Okay.
And yeah, I've sent them emails, and then they will reach out to me. One of them actually reached out to me. He is their implementing partner, and he said he will ask around and see if there are opportunities that we can explore for the Northern Health Shield.
Great.
And then I went to Mastercard. Mastercard has an office in Accra, and for this note, I actually wrote it down because I didn't want to mince my words when I'm talking. Okay. So the key takeaway is that Mastercard Foundation may not be the best fit for direct health outreach or WASH funding requests because their African focus is more centered on youth employment, education, entrepreneurship, and pathways to dignified work, especially for young women. However, the Northern Health Shield could be positioned for Mastercard if we frame it around workforce development. For example, we could explore a concept note showing how the project can train and employ young people in Northern Ghana as community health workers, hygiene ambassadors, referral navigators, wash maintenance workers, or data collectors. The suggestion was to avoid approaching Mastercard as a small standalone organization, NGO grant request, and instead consider a system or partnership angle, possibly with Ghana Health Service, a university, or an existing Mastercard partner that maybe has gotten funding from them, and they would sort of focus on the employment aspect or the dignified career pathways, and then we provide like the job or like what is actually providing the jobs or the career. Yeah, and they also mentioned that Mastercard is not even funding any projects in 2026. So if we are approaching them, it will be just to let them know of our projects ahead of 2027.
Okay.
Yeah. So something that I just wanted to share.
Yeah, it's good information to share. And I think that, knowing that there's not anything there right there now in 26 with all these other leads, I think we just know that those are potential options for 27 and that we could maybe pursue some of those in the future.
Yeah. I also came across a very interesting article. So the article emphasizes that water is not just a technical infrastructure, or it's not just a technical or infrastructure issue. It should also be seen as governance and development priority. So they have consolidated different leaders in the various countries in Africa, and these leaders would add water to their agendas, and smaller NGOs could become their implementing partners. So the man that is representing Ghana is Alhaji Mumin. I will speak to Salam and see if he knows someone close to him that we could start talking to, because these are politically inclined.
Yeah.
Yeah.
I think
And
that's a
then,
great. I think that's a great idea because,
yeah,
as I always talk to about Salam, I talked to Salam about this over many years. Is that one of the things that that matters is policy, and if we can
yeah,
get in front of policymakers to make some of these initiatives part of their policy proposals, things like
hmm,
sanitary pads at a discount or free, or condoms, or vaccinations, or water. All of these things are good things to approach would-be leaders with, and help them drive these policy changes for the people.
yeah. I couldn't agree more.
Yeah,
Yeah. So,
that's
Presido,
great.
I found two very interesting grant opportunities that we really qualify for. I would schedule a meeting with you tomorrow so that we go through them. And then, if you give the okay, I'll go ahead and apply for them. There are two.
Great.
Yeah, that sounds wonderful. Perfect.
Okay.
Super exciting. Excellent work, Warihana, on
Yes.
all of the connections and all of the research and all of the submissions and follow up. Really, really good. And I think all of those projects are showing up in active projects. It looks like we have them there. If you need to create more or having problems, please, as you create them, check the active projects, and then we'll do a more diligent job of going through each of those in the meetings to make sure that we get statuses on them if there are. Some we realize there obviously aren't, but it's all good.
Okay.
Yeah,
All right.
excellent.
Yeah, that's all from me.
Okay, great. Thank
Great.
you.
So much. Ben, how about you? Anything else for the meeting?
No, nothing from me.
Okay. Thank you. So sorry we went over. I think the app explanation, little brief workshop was needed, but definitely worth it. But thank you so much for your time and energy this evening. I wish you all a great evening, and we will see you on Sunday. Okay.
Great.
Okay.
Thank
Okay,
you
see
so
you on
much,
Sunday.
everyone.
Okay.
Bye-bye.
All right,
Bye-bye.
bye bye.
Bye.